Good morning, good afternoon, everyone.
As women, usually we put others before us, and we take care of so many things, our career, our families, even our communities. But today, I want us to pause and focus on ourselves because our health is our greatest asset. Permit me to ask this question. How many of us have had a cervical screening or a pap smear before? Most important thing is that we are here to talk about cervical health, and cervical screening is one of the important things to discuss. So I'm hopeful that even if anyone has not had a screening before, by the end of this presentation, we will all know the importance of cervical screening, and then hopefully we book one and get it done. So I will start by sharing with us the power of knowledge and taking action, a story about Mrs. A. So Mrs. A is a 35-year-old lawyer, wife, and mother who takes her health seriously. One day she noticed bleeding between her periods, abnormal discharge, and pain during intercourse. Immediately, fear gripped her heart. Could this be cervical cancer? Mrs. A thought. Remember what she had learned from health webinars, that her symptoms could signify something serious. She acted immediately and saw her doctor the same day. Despite her anxiety, she was reassured when her doctor confirmed that her regular pap smear had always been normal. After tests, she was diagnosed with cervicitis, a treatable infection of the cervix, and with a simple course of antibiotics and counseling, her symptoms disappeared within a week, and she returned to her normal life. So why do we need to talk about Mrs. Hayes' story? Because it teaches us very important lessons. It teaches us that knowledge saves lives. Because Mrs. Hay was informed about abnormal symptoms and what these symptoms could mean, she knew to seek help immediately. Mrs. Hayes' story also teaches us that regular cervical screening gives confidence. Since she had done her pap smears regularly, she knew her risk of cervical cancer was low, especially when the doctor confirmed that the results had always been normal. Another thing that I want us to take from this story is that not every symptoms means cancer. There are many women health issues that can present similarly, just like Mrs. A's symptoms, and not necessarily cancer. But the most important thing is to present early to your healthcare provider, because early medical attention can prevent unnecessary panic. So Mrs. A's story is one of empowerment. She was informed, she took action, and because of that, she got the right treatment on time. But not every woman knows what to do when they notice these symptoms. Some ignore them, some are afraid. Some don't even know that cervical cancer is preventable. And that is why we are here today, to learn, to ask questions, and to make sure that no woman joining us today or anyone in our families suffers because of lack of knowledge. So let's talk about it, cervical health, what every woman should know. So we should be on slide 7 now.
Okay.
So let's talk about the cervix. So the cervix is part of the female reproductive system. When I say the female reproductive system, that is part of a woman's body that helps with reproduction, the part that helps in making babies, okay? So the cervix is that part of the female reproductive system that expands or dilates, it opens so that your baby can be born. So that is one of the important roles that the cervix plays in the female reproductive system. And common cervical health issues include infections and cervical cancer. Next slide, please. So let's talk about cervical infection. An infection of the cervix is known as cervicitis. It can present with symptoms such as unusual vaginal discharge, pain during sex, and unusual vaginal bleeding. So when I say unusual vaginal bleeding, this can be in form of bleeding between periods. And bleeding between periods means that as a woman, assuming you've completed your period for this month, maybe it lasts 5 days, 3 days, and then you're not expecting your period until the next maybe 23 days or 28 days. And before that 23 or 28 days that you're expecting your next period, you notice a spotting, that is small amount of blood, or it could be a large amount of blood or clots before your period is due. That is bleeding between periods. It is abnormal, but it can be caused by so many things, some of which does not have to be cancer, so don't panic. Unusual bleeding can also be in the form of post-coital bleeding, that is bleeding after sexual intercourse, or in women who have achieved menopause, that is in women who have stopped their period completely. If they now notice they start to bleed again, that is postmenopausal bleeding. And this is also one of the presentation of a cervical infection. Cervical infection is easy to treat. Usually with a course of antibiotics, it goes away. But if you refuse to get it treated, it can result into complications, which is known as pelvic inflammatory disease. Now, this is the cervix here. I don't know if you can see the arrow. I'm not sure. Okay. So this is the cervix. Now, if you have a cervical infection, if anyone has a cervical infection and is not treated, the infection can go up into the uterus, which is the womb above the cervix, and then can go up into the tubes and then into the ovaries and cause, so infection in any of these organs is known as pelvic inflammatory disease. So that is what happens if someone has a cervical infection and does not get it treated. And what can happen as a result is infertility. So it is important to get it treated. It is important if we notice something unusual to consult our healthcare provider. Next slide, please. So let's talk about cervical cancer. What is cervical cancer? A cancer is an abnormal and an excessive growth of cells in the body. These abnormal cells can form lumps, which is otherwise known as tumors, or they can spread to other parts of the body. Cancer can happen in almost any part of the body, and the symptoms depend on where it starts from. So cervical cancer is one in which the cancer starts from the cervix. Next slide. So why are we talking about cervical cancer? I think a little bit of statistics will help us to understand the burden of cervical cancer and why we need to talk about it. So all over the world, cervical cancer is the fourth most common cancer in women. So it's all over the world, around 660,000 new cases are diagnosed every year. And from the second graph on the right side, we can see that around 350,000 deaths are recorded annually as a result of cervical cancer. Next slide. So this graph shows us the statistics of cervical cancer in Nigeria. Looking at this blue line, we can see that cervical cancer is the second most frequent cancer among women in Nigeria. And the red one shows the number of people who die as a result of cervical cancer every year. And it's telling us that it's the second most frequent cancer death among women between the age of 15 to 44 years. That is shocking, especially knowing that cervical cancer is preventable. Next slide. Now, let's talk about some of the myths and misconceptions about cervical cancer. I would encourage us to share, maybe in the chat, about any myths or misconceptions that we've heard about cervical cancer, or maybe the things that you know are the causes of cervical cancer. Maybe there's anything you've heard before. Are we getting any responses?
Yeah, I'm monitoring now.
Okay, I'll give us a few seconds and see if anyone will respond. Okay, in the absence of responses, I'll move on to slide 13. Now, this is a true or false game. So, cervical cancer is caused by witchcraft. True or false?
False.
Okay. Only promiscuous women get cervical cancer. True or false?
That's false.
Okay.
Because
Cervical cancer only affects older women. True or false?
false.
False.
Yes. So that's right. You got everything correct. So cervical cancer is caused by HPV and other risk factors. And any woman who is exposed to HPV can get cervical cancer. So not just promiscuous women. And cervical cancer can affect young women too, not just older women. Slide 15. Now, let's talk about the causes and risk factors for cervical cancer. So, anything that increases your risk of getting a disease is called a risk factor. So, the causes and risk factors for cervical cancer includes human papilloma virus, HPV. This virus is responsible for up to 99% of cases of cervical cancer. Other risk factors include age. It is known that younger females are more at risk of getting cervical cancer. And studies have shown that it is most common in women in their early 30s. Multiple sexual partners. The reason being that it increases the risk of HPV infection. Early sexual activity or early age of sexual activity is also another risk factor. And the reason is because the cervix is more vulnerable at a younger age. So there's an increased risk of HPV infection. Weakened immune system. So conditions that weaken the immune system like HIV/AIDS, cancer in any other part of the body, transplants, these are conditions that can weaken the immune system. And they increase the risk of someone having cervical cancer. Smoking also increases the likelihood of cervical cancer. Slide 16. So let's talk about HPV because it is responsible for up to 99% of cervical cancer cases. It's a very common virus that affects both males and females, and it is passed from one person to another through sexual contacts, through skin-to-skin contacts. When I say sexual contact, it doesn't necessarily mean sexual intercourse, okay? Any form of sexual contact, whether anal sex, oral sex, male to male sex, female to female sex, HPV can be passed through this form of sexual contacts. And 8 out of 10 sexually active people will be infected with HPV at some point in their lives. What happens when someone gets HPV infection? In most cases, our immune system clears it from the body. We are blessed with our immune system. It is like a system of soldiers that help us to fight infection. And most times we don't even know that we had an infection because our immune system would have cleared it. And that is the same thing that happens when someone gets HPV infection. However, in some people, the body refuses to clear this infection. And when it persists, it can result into cervical cancer. HPV can also cause other cancers like vaginal cancer and vulvar cancer in women, cancer of the penis in men, and mouth and throat cancers in both male and female. A very dangerous virus it is. Next slide. So this is just an illustration of what happens when someone has HPV infection. So two things can happen. On the left, it is showing us that most people will clear HPV from the body without it causing any symptoms or problems. If that does not happen, and if it is a high-risk type of HPV, it is showing us what can happen on the right side. It can stay in the body for a long time and cause damage to the cells. It then causes the cells to divide and grow out of proportion, out of control, thereby leading to cervical cancer. Next slide. So if someone has HPV infection that the body refuses to clear, it can take 15 to 20 years for this to cause abnormal cells, which can then become cervical cancer. However, in some people, this progression can be faster and take 5 to 10 years. And there are some risk factors that can accelerate the progression into cervical cancer. And this include the grade of the oncogenicity of the HPV type. What I mean by this is some HPV are more dangerous than the others. There are different strains of HPV. So if it is a more dangerous HPV type that someone is infected with, it could cause the progression to become faster. Also, immune status, weakened immune status. The presence of other sexually transmitted infection is another factor that can aid the progression quicker. So if someone has other sexually transmitted infections like gonorrhea or chlamydia, then the progression can be faster. Number of births. Studies have shown that people with higher number of births have faster progression. And the reason is because with increasing number of births, it means that the cervix is being exposed to different hormonal changes with each birth. And because of the hormonal changes that occur in the cervix, it makes it more vulnerable to HPV infection. The same thing goes for young age at first pregnancy. Because the cervix is still developing during the teenage years, it makes it more vulnerable to infections like HPV. Also, if someone gets HPV infection at a younger age, it means that there is a long time for the infection to cause abnormal cell changes, which can then result into cervical cancer. The use of hormonal contraceptive is also another risk factor that can cause the progression to become faster. And the reason is because hormonal contraceptive use disrupts the normal hormonal balance in the cervix, making it more vulnerable. And smoking also makes it harder for the immune system to protect against HPV infections and to clear HPV from the body. Slide 19. Now, let's talk about symptoms of cervical cancer. In the early stage, there is often no symptoms at all. This is why it is important to go for screening. And if we notice any symptoms, to present early. Okay. Now, in advanced stages, the presentation can be in form of unusual bleeding from the vagina, like I explained earlier, bleeding between periods, bleeding after sex, or bleeding after menopause. It can also present as a foul-smelling discharge or a blood-stained discharge from the vagina. Pain during sexual intercourse, and in advanced stages, very advanced stages, it can present with pelvic pain or lower back pain. Next slide. So how do we prevent cervical cancer? Because I said it is almost 100% preventable. And because of this, no one should be coming down with cervical cancer, and nobody should die because of something which is 100% preventable. So these are the different strategies for preventing cervical cancer. Next, HPV vaccination, screening, safe sexual practices, healthy lifestyle, and early detection. Slide 21, please. So, knowing that cervical cancer is the second commonest cancer in Nigeria, and knowing that is the second most frequent cause of cancer death among women in Nigeria, and knowing that it is almost 100% preventable, how many of us joining us today would take a vaccine that could prevent cervical cancer? I think almost everyone will get that vaccine. Unfortunately, the vaccine is not for everyone. So the World Health Organization recommends it for children aged 9 to 14 years. So if you have a child, if you live in the UK and you have a male or female child who is in year 8, age 12, 13, thereabouts, contact your GP and let them get the HPV vaccine. It can prevent cervical cancer and other HPV-related cancers, like I mentioned earlier, including the vulvar cancer, vaginal cancer, and in males, cancer of the penis, okay? In Nigeria, it is free for girls only, okay, from the age of 9 to 14 years. So kindly check your child's immunization record. If you have a child between the age of 9 to 14, a girl child between the age of 9 to 14 years, kindly check their immunization card and make sure that they have gotten their HPV vaccine. If not, please contact your immunization center or go to your immunization center and get your child vaccinated. Because by giving them the HPV vaccine, you are protecting their future. Next slide, please. Sorry, before next slide, I mentioned here that up to the age of 25 years. So in some countries, HPV vaccine is also given to some people up to the age of 25 years. So if your child has passed the normal age of the HPV vaccine, but they are still less than 25 years of age, they can still get the HPV vaccine. There are also some criteria for other people. And in some countries, people up to the age of 45 years can get it. But if you are between 25 and 45 years in the UK and you do not meet this criteria, then you have to pay for it on your own. However, the benefits of taking it beyond the age of 25 years is doubtful, because most people would have had sexual contact at that age, and as a result would have been infected with HPV infection. So it is doubtful whether it is beneficial beyond the age of 25 years. Next slide, please. So let's talk about cervical screening, or pap smear, as the case may be. So The World Health Organization recommends cervical screening as a strategy to prevent cervical cancer in women from the age of 30. In the UK, it is done from the age of 25 years. And why do we need to do a screening? What happens when we do a screening? What happens is that it can detect abnormal cells, which when treated, it prevents cervical cancer. So if you go for a screening, what happens is that they take a sample from your cervix and check for the presence of HPV infection. If there is no HPV infection, that's the end of the screening. But peradventure, it detects HPV infection. Then they will now go ahead and check if that HPV infection has caused any abnormal cell changes in your cervix. If there is no abnormal cell changes, you will be asked to come back for a repeat screening in a year's time. If, however, there are abnormal cell changes that the HPV infection has already caused, then you will be referred for further testing known as colposcopy. So what colposcopy does is to check further what type of abnormal cell changes has occurred and then treat it. The most important thing is that cervical screening checks for cell changes before they become cervical cancer. And it can be treated with maybe removal of the abnormal cell changes, or by therapy such as cold therapy to freeze the abnormal cell changes, or heat therapy. There is treatment for abnormal cell changes, which is also known as precancers, so that they do not turn into cervical cancer. So how often should one go for screening? So from the age of 25 years to 49 years, you should go for screening every 3 years. And from the age of 50 to 64 years, it should be every 5 years. Some countries are now moving into 5 yearly for everyone. But most important thing is make sure you go for cervical screening. It is life-saving. Slide 23. So we also talked about safe sexual practices as one of the strategies for preventing cervical cancer. And the reason is because it reduces HPV infection transmission. So if you can use barrier methods of contraception like condoms, not necessarily for contraception, but as a means of preventing HPV and other sexually transmitted infection. Also, by limiting the number of sexual partners, you are in a way practicing safe sexual practices and reducing HPV infection transmission. Next slide. Healthy lifestyle. So this cannot be overemphasized because healthy lifestyle helps to prevent so many diseases of human. And this includes healthy diets, eating a lot of fruits and vegetables, exercising, by stopping smoking for people who smoke, and avoiding excess alcohol consumption. Healthy lifestyle boosts our immunity. That is the system of soldiers that help us to fight infection, and thereby can help us to fight HPV infection and clear it so it doesn't cause abnormal cell changes that can lead to cervical cancer. Next slide. Early detection. So if we recognize any unusual symptoms, it is important to seek medical help immediately because early detection can save lives. If we fail to do this, it means peradventure is cervical cancer. That means that person is missing the opportunity to get it cured at an early stage. And what happens is that it can progress and spread to other parts of the body, and can even cause things like paralysis, whereby someone might not be able to walk if it spreads to the spine. So it is important to contact your healthcare provider if you notice anything unusual immediately. Treatment options. Prevention someone gets cervical cancer, there are treatment options available. In early stages, surgery can be done to remove the cancer or remove the cervix or the womb and the cervix, as the case may be. If the cancer has spread to other parts of the body, treatments like radiation therapy or medications like chemotherapy can be given to that individual. Next slide. So, take-home message is that cervical cancer is almost 100% preventable. Go for cervical screening if you are age 25 and up to the age of 64 years, because it is a life-saving procedure, okay? And if you have a child, a daughter, especially for cervical cancer, we are talking about female child, between the age of 9 to 14 years, ensure they have HPV vaccine. And if you notice anything unusual, bleeding from your vagina, abdominal discharge from your vagina, pain during intercourse, pain in your pelvis, or lower back pain, this could signify cervical cancer. But don't panic, as most times it is not cervical cancer, but you need to get it checked. Thank you for listening to my talk. Questions, please?
Wow. That was truly enlightening. Thank you so much, Ma. Thank you. That was a lovely presentation, by the way. Um, Probably before we open up to the audience, because I know some people might have some questions in mind. So, talking about the misconception about the cervical cancer. So, can we get to know the biggest misconception? Like, what are the biggest misconceptions about cervical cancer?
Well, um, I'm not sure what the biggest misconception is, but as someone who grew up in Nigeria, I know when people talk about cancer generally, they say it's caused by witchcraft or it's a spiritual problem. And I think that's the greatest misconception. So it is not caused by witchcraft. It is not a spiritual problem. It is cervical cancer as its own cause, which is mainly HPV and other risk factors, which we have discussed.
All right. So, please, from those who are watching us or those are on stage, if there's any question, you are free to ask now. And let's make that fast within 5 minutes.
Okay, so my
Oh,
own question
we
is
have
about
comments. We have
okay.
comments. Sir. Someone said one major cause of cervical cancer, from my understanding, can be caused by a particular strain of HPV, and this can be spread through sexual. Oh, okay. That has been discussed already. All right. You can go ahead with your question, ma.
Okay, so my question is about I think there was something about contraceptive use. So I wanted more explanations on that. If there are specific contraceptive that could increase the
Right. Yeah.
yeah.
Okay. Yeah. Okay. Yeah. So you want to know about if there are any specific contraceptions that can
Yeah.
increase the likelihood of getting cervical cancer. So
Yeah.
hormonal contraceptive, especially the combined oral contraceptive pill, because it has both estrogen and progesterone hormone, is known to be a risk factor for HPV progression. So the HPV is the infection that can cause abnormal cell changes. So it's a risk factor that it can increase the likelihood of getting HPV infection and making the HPV infection progress into abnormal cell changes that can lead to cervical cancer. So the combined oral contraceptive pills.
Okay.
And the reason is because I think it disrupts the hormonal balance. You have your estrogen and progesterone in your body. So by taking the pills, you're getting more estrogen and progesterone, which tends to disrupt your normal balance. So that's the reason.
All right. Thank you, ma.
Ma'am, but what about the what is it called? These the regular contraception pills.
Yeah, so that's the one I just made, the combined one. So there are two types of pills. One has only the progesterone hormone. That's the progesterone only pill. And the other one has both estrogen and progesterone. That one is called the combined pills. So it is the combined pills that is a risk factor for cervical cancer. So if you're on a pill and you're not sure if it's the combined one or the progesterone only one, you can contact your GP. Or if you're in Nigeria, maybe contact your doctor, and then they will let you know the type that you're taking. I mean, not everyone taking the combined pill. It doesn't mean that, okay, you're taking combined pill, you will come down with cervical cancer. No, not necessarily. But if you have HPV infection or abnormal cell changes already and you're taking the combined pill, then it can make the progression faster to cervical cancer.
Okay. So there's a question on Facebook there. Are there vaccine for males? So probably it's the same vaccine that is given to male and female or
Yes,
there.
so there are vaccines for males as well. In the UK, both girls and boys are vaccinated. But in Nigeria, I think it's free only for girls aged 9 to 14 years. But
Okay.
if you want your male child to get vaccinated in Nigeria, then you need to pay out of pocket for it. So contact your immunization center. I'm sure if you tell them you want to pay for it, they should be able to make it available for your boy child. Because it's not just preventing cervical cancer, it's preventing cancer in males as well, like cancer of the penis, mouth cancer, throat cancer in both men and women.
Okay.
Well,
So
ma, following that, um, this maybe let's say this cervical cancer, or how would I put it? Just like it's women that has cervix, right?
Cervix,
And
yeah.
yes, so and it's from this maybe related to infection or something that can cause this cervical cancer. So
Yes.
why does it affect men?
So
Does
cervical cancer does not affect men.
okay.
Cervical cancer is for women, but HPV infection affects both men and women. And HPV infection is the virus that causes up to 99% cases of cervical cancer. So that means as a woman, you can get HPV infection from a man, okay? Because men can be affected by HPV infection. So it's transmitted through sexual contact, as mentioned earlier, not just sexual intercourse, male to female sexual intercourse, male to male intercourse, like anal sex, okay? Oral sex, any form of sexual contacts can transmit HPV infection. Have I explained your?
Yes, yes.
Okay.
So basically, men would get like there's a risk of men developing another type of cancer that is not
Yes.
cervical cancer as a result of
Yes.
HPV.
Yes.
And now that there's no test to check for HPV in men, I don't know if there's any research that is being done or anything that is ongoing, because if there's no test to confirm HPV in men, you know, and a woman is susceptible to HPV, it's like it's still coming back. Like, except you don't understand what I mean. You are, even if you're
Yeah.
not, even if you're changing partner, you can't even say that the next partner doesn't have HPV because there's no test to confirm all these things.
Yeah, I understand your questions, and I'm not aware of any research that's being done currently to find out how HPV infection can be confirmed, both in male and females, really. Because cervical screening is for women from age of 25 years. So before the age of 25 years, you might have been infected with HPV infection because you might have had a sexual contact that has made you that has transmitted the HPV infection already. It is difficult to know where you have gotten the HPV infection from. It doesn't necessarily have to be from the current partner. It may be from an old partner, a previous partner. So, I mean, trying to figure out if it's from your current partner or trying to figure out, oh, where did I get the HPV infection? I think it will lead to unnecessary anxiety and panic, really, because there is, at the moment, there is no way of finding out. And I'm not aware of any researches that is being done.
Okay, I think there's a question in the chat.
So, are there potential genetic predisposition to coming down with cervical cancer, please? So, there is no genetic predisposition to coming down with cervical cancer. I mean, cancers like breast cancer have a genetic predisposition to it, but cervical cancer, no.
Ma, though I think this is not really related to this cover, but I have a doubt in UTI, urinary tract infection, and is there anything called pelvic infection?
Pelvic infection. So, if you're asking me if there's anything called pelvic infection, there I'll be thinking, do you mean pelvic inflammatory disease? Because pelvic inflammatory disease is an infection of the pelvis of the female reproductive system. So when we talk about the female pelvis, we are talking about. So I think I have a slide here that shows the female reproductive system. Let me see. It should be slide 7. If we can bring that slide up.
Okay.
Are we on slide 7?
Yes. Can you see it
Okay.
now?
Yeah. So this diagram here. So this is your whole pelvis here. Okay. You can see the fallopian tube, your ovaries, your womb, the cervix, and the vagina. This is the female pelvis. So an infection in any of these organ is a pelvic infection. And usually we refer to that as a pelvic inflammatory disease. If the infection goes up maybe from the cervix and then goes to any of these, then it's a pelvic inflammatory disease. And there's a risk of infertility if that is not treated. It has other complications as well that could arise as a result of that. So if you're asking me pelvic infection, I would say it's an infection in any of these organs. Did I answer your question?
Oh yeah,
Okay.
yes, because I've been told something like that, and another doctor is trying to say there's nothing called pelvic infection. So it
Mm.
really gives a confuse. It's really kind of confusing. So that was why I
Okay, okay. So, I mean, what was it in Nigeria or the UK?
yes, it was in Nigeria.
Nigeria, okay, okay. Because I wouldn't expect any doctor in the UK to tell you that there is nothing called a pelvic infection. Um, and when you said it was in Nigeria, was it a doctor you spoke to or
Yeah, it was a doctor that confirmed pelvic infection.
okay?
But seeing another doctor, I think I don't, I can't really remember what the case is that led to another doctor saying there is nothing called pelvic infection. And I was
Yeah,
like,
yeah.
the doctor,
I mean,
because the doctors did a scan to have bring something like that. And that time the doctor was what is it called, referring the pelvic infection, so he's trying to refer to the womb side or so, even though he
gynecologist,
didn't
okay,
really
yeah.
explain the result of the scan or something. So, and that time I only used Google to just know about the pelvic or
Okay.
something, but you just be I was just confused of how can this be despite maybe taking care of yourself or hygiene or something.
Okay. So there is pelvic infection, there is, and it's also known as pelvic inflammatory disease.
All right.
Okay.
So what about UTI?
So UTI is a different entity. Okay. So UTI is a urinary tract infection,
Mhm.
and it's commonly known as water infection in the UK. The reason is because when we say UTI, water infection, because your urine is your water works. When we talk about urine in the UK, if they want to ask about your urine, they can ask you how is your water works, okay? Because that is the way by which you're removing water from your body, okay? So an infection in the urinary tracts is called a urinary tract infection. Okay. And this can be infection in the ureter, okay, or infection in the kidney. A kidney infection, because an infection in your urine can go up into your kidneys and cause a kidney infection. So it's a different entity entirely. So a urine infection is different from a pelvic infection. A urine infection is water infection, and it's infection in your urinary tract. This the systems that helps in removing urine from the body.
So sorry, is there any what is it called? Why, or let me say, is it, should I ask for symptoms or what causes it?
So what
Or is there
causes
any
urine?
complications if
Yeah. Okay. So urine infection is caused by bacteria bugs, bacteria infection. So how does it happen? Let's say, as a female, because I'm talking about one of the risk factors, you go to the toilet, you have a poo, and while trying to poo, you wiped from your back, from your bum area, from your back passage, you wiped into your front area, from back to the front. You wiped that way. So the back area, the back passage, the anus, is rich in bacteria. So that means you're introducing bacteria from your anus, from your back passage, into your front area, which is the vaginal area and the urine and the urethra where the urine flows out from. So that bacteria can then go on to cause an infection in your urinary tracts. So that is one of the ways by which you can get a urine infection. And it can present as a burning pain when passing urine, okay? Or you can pass urine more frequently. Maybe in a day, you usually pass urine maybe 3 or 4 times. It can increase to maybe 7, 8 times. And you can also wake up in the night to be passing urine. Maybe in the night, in the night, you wake up maybe 1 or 2. But when you get a urine infection, you can wake up 3 or 4 times. Okay. Also, It can present as blood in the urine. So if there is blood in urine, it could be because of a urine infection. So there is treatment for it. Course of antibiotics will take care of a urine infection. If it is not treated, then it can ascend. That means it can go up and go into the kidneys and cause kidney infection. Do you understand?
Yes.
Yeah, well understood.
Yeah.
Oh, that's that's lovely. Now more enlightened.
Yeah.
But another thing I want to ask is, if you are feeling infections, or you are detected that you have this kind of infection, and you are not keeping many sexual partners, like maybe on one. So if your partner, you know, most symptoms that we try to see is maybe itching, maybe from your private parts, or I don't know, but the most common symptom that you see is that. So, and if your partner is not feeling that kind, saying maybe he is not feeling the infection part. Of course, if you are to be treated, they will treat both of you. But why is it that, like, in that sense, in that kind of infections, like, apart from maybe hygiene or something, it's also can be caused for maybe sexual meats. So why is it mostly felt from the female gender than
And the male gender. Right. So there are different types of infections. Okay. Let's not mix it up. Urine infection is different from pelvic infection and is different from sexually transmitted infection. So I've explained urine infection, okay? Urine infection, yeah, I've explained that. Now, sexually transmitted infections. In females, it can present as abnormal discharge from the vagina, okay? Maybe a foul smelling discharge, okay? A change in color of the discharge, or increase in the quantity of the discharge. Also can present as pain in the pelvis, okay? Or an unusual bleeding from the pelvis, from the vagina. So that's the presentation of a sexually transmitted infection. Males too, when they have a sexually transmitted infection, they can show symptoms such as discharge from their urethra or discharge from their penis. But I think most males are asymptomatic. They do not show symptoms. That is the way they are built. Okay. But as a woman, if you notice something unusual, you need to get it treated. If it's a sexually transmitted infection, you need to inform your sexual partner to go for testing as well. Ideally, they should go for testing first. And if it comes back that they have the sexually transmitted infection as well, then they need to get treated. And for most sexually transmitted infection, it is advisable that when you are getting treated, if you cannot abstain from sexual intercourse at that time, then use a barrier method of contraception like a condom, because you don't want a reinfection. Okay. So these are the things you need to ask. How long, when you're getting treated, I'm not saying you, but when someone has an infection and is getting treated, when can I resume intercourse? Things like that, because you don't want a reinfection. So that is for sexually transmitted infection. You mentioned itching. So itching alone, vaginal itching alone, is not a symptom of sexually transmitted infection, because other infections can cause itching. For example, candida infection, which is a fungal infection, a yeast infection, okay, can present as itching, and it's the commonest cause of vaginal itching in women is a yeast infection, and it's not a sexually transmitted infection. Okay, and that one can be treated with fungal antifungal medications. Okay, so vaginal itching is not necessarily a sexually transmitted infection. I'm not sure if I have answered your question correctly. Oh,
Yeah, you did.
okay.
Thank you, ma.
Thank you so
So
much,
any
Ma.
other
So,
question?
yeah, just the last one. And that's based on what we do here, trying to empower women with information and the rest. It looks like we still have a long way in terms of changing minds of people, because if people are aware of something and there's still this myth about, okay, all these medical things are not real, I don't want to do it. And I'm saying this because I spoke to someone recently about smear test, and the person was like, oh, they were calling me for smear test, but I don't want to go because I don't want anybody to touch anything. So I'm not sure how we can go about that advocacy to make women see that this thing is about you, is to help you. I think there's still a gap between there's still that gap there on how to convince women to say this thing is for you. Maybe there's a
Hmm.
kind of misconception that any altering or any touching of the cervix, because when you go for smear test, your tap cervix probably is touched in a way, and there's that fear of, oh, it's because they touched it, that's why something started happening, you know. So I'm not sure how we'll go about it. Maybe to also enlighten them that their test is not painful. It doesn't have any after um, implication after it's done or something. It's not going to result in anything. So I think they still. I don't know how we go about that in terms of helping women.
Hmm. Yeah, I think that's a very important question or comment, so to say.
I have similar experience with what you just say now.
Mm,
Because there was a time I had a miscarriage, and I think what is this medical term when they do flush out?
They and say,
Is it the answer? I don't know.
is it evacuation or aspiration or which one?
I think it's evacuation.
Hmm.
Trying to remove the remaining.
Yeah.
Okay, yes. So, and I think after that, it now seems like maybe feeling infertile, and I think it's after that during the scan that led to that pelvic infection that I asked earlier, because I went for a scan. That was when no, before going for a scan I was feeling heavy pain on my abdomen that I couldn't walk. So went for a scan, and during the scan, that was when the doctor was confirming that I have pelvic infection, which is related to my womb or so. And though that time he prescribed some medications. So, at that point in time, your thinking will now be like, what could have caused this? Can
Mm,
it be during the previous, maybe clean up, maybe from the previous hospital or something? So if there should be another thing, or there should be another case of doing something, you will be scared, or you'll be fear. You have that fear that no, you don't want this kind of thing, because if this thing should have resulted to maybe womb affected, then, and it's not that something you've done some, maybe, or what is related to the cause, or that can causes
mm,
that
mm.
affection exactly.
Yeah, I understand you. I mean, sometimes we find ourselves blaming ourselves and trying to find out what exactly we have done that could have caused something like that. Sorry about your experience. Accept that, okay? Yeah, so I mean, if someone told me that they don't want to go for pap smear or cervical screening, I think I would want to understand the reason for not wanting to do that. What are their fears? What are their worries about going for it? And then maybe trying to address those fears and anxiety and worries can help them. And also, if they understand why the cervical, the past smear, why it's been done, okay, maybe in a way that could change their mind, because most people do not even understand why they are being asked to come and do pap smear, especially in countries like UK where it is free. You are not
Yeah.
paying for it. Yours is just to present to your GP and then they get the sample and then that's it. Do they understand that it's to prevent cervical cancer? Do they understand the burden of cervical cancer? Do they even know that it's something that is 100% preventable through screening and vaccination? I mean, talking them through all this, if it's someone who wants to listen really,
Mm.
yeah, so maybe that could change their mind. I mean, here you cannot force anyone. Yours is to present to them, this is what you want to do, this is what we want you to do, and this is the reason. So it's up to them to make that decision that they want to go ahead with it or not. But then we cannot stop doing what we are doing. We will continue to advocate. Okay, we will continue to encourage people to do what is best for their health, to protect their future.
So we
Okay.
have a lot of questions here. Oh.
Okay.
You didn't check the questions. So someone said, "What can I do to stop the reoccurrence of TI?"
Right. Um, so we are asking how to prevent recurrent urinary tract infection. So, as a woman, wiping, if you want to wipe after using the toilet, you wipe from your front to your back. Don't wipe from your back to your front, because you're wiping from back to front, then you are introducing bacteria to your front passage. We can then go up and cause urinary tract infection. Stay hydrated, okay? There are some studies that were done that shows that by drinking plenty water, when you start to notice symptoms of a water infection, you can actually clear the water infection. So make sure to drink plenty of water, okay? And then some have also talked about the kind of underwears that you wear, avoiding tight underwears, things like that can also help to prevent recurrent urinary tract infection. If it's an elderly person, like someone who has already reached menopause and they're having recurrent water infection, things like vaginal estrogen cream can help to prevent recurrent water infection, but they need to speak to their healthcare provider to get assessed for that and get it right.
All right. So another person say, so from the doctor explanation, it seems HPVs are very common, and most times we have no control over exposures. So is it that all we need to do is to build a strong immunity by eating healthy?
Right. So, um, HPV infection, yes, it is very, very common. 8 out of 10 sexually active people will develop HPV infection at some point in their life, just to show how common it is. But the truth is, most people will clear it from their body. Even without knowing that you had HPV infection, you will clear it from your body. The worrisome bit is the HPV infection that refuses to be cleared from the body, because that one can persist and lead to abnormal cells. So all we need to do is to build a strong immunity by eating healthy. No, that isn't all we need to do. Building a strong immunity by eating healthy can help our can in a way help us to clear HPV infection if we have a strong immunity. But even with strong immunity, in some people, that can still progress to HPV, to abnormal cells that can lead to cervical cancer. So what is important is to go for cervical screening. That is the only way by which HPV infection that's become persistent can be detected. Okay. And then it can also detect if it has caused abnormal cell changes before it results into cervical cancer. So it's cervical screening pap smear.
All right.
Yeah.
So another question says, is it necessary for one's partner to also treat himself in case of pelvic infection?
Well, in case of I would say if you are in Nigeria, I think it's just best for your partner to get treated as well. Because unless you have access to um, investigations whereby they can take a sample and find out the type of bacteria that has caused the the pelvic infection. So if it's a bacteria that is sexually transmitted and the partner needs treatment for it, then the partner can also get tested before getting treated for it. You see, it's a long process. So in the UK, that is what happens. If it's a pelvic inflammatory disease, you get tested. Is it an STI? They will confirm. And then your partner will also get tested. And then if their result comes back positive for STI, they get treated as well. If your partner is not positive for STI, they don't need to get treated for it. But if you don't have access to all of this, just to be on the safe side, and you're sure it's a pelvic infection, then it's best for the partner to get treatment as well.
Okay. So another question says, about the urine infection, is it possible to have discharge apart from peeing constantly?
So for urine infection, abnormal discharge from the vagina is not a symptom of urine infection. So abnormal discharge from the vagina could be because of so many things, including infection, including cancer. I'm not scaring you, I'm just saying it is also a presentation of cancer. So if you're having persistent or you have abnormal discharge from your vagina, please consult your doctor. Let them get consult your doctor or get it checked to find out what is causing it. But vaginal discharge is not a symptom of urine infection.
Okay.
Yeah.
I
I
think I
mean, I was going to mention this as part of the things that you can do to stop recurrence of UTIs, also to stop holding urine for too long.
yeah.
If you have a sense of wanting to go to the urine to pass, so to the toilet to pass urine, go immediately. Don't wait for too long, because when you wait for too long, it means that you are creating an environment for bugs to thrive and multiply. Okay, so don't do that.
Okay. So someone said, is there any potential genetic predisposition to coming down
Oh,
with, has that been
Yeah,
answered?
yeah,
yes,
that's
yes,
been
yes.
answered.
Okay. I thought I missed that. All right. I think that's all for now.
Yeah.
Okay. So that's all for now. I think we've answered all the question. Thank you so much, Ma. Thanks for the word presentation. So I don't know if any other person have we don't know if Dr. Shewa has something to tell us.
Thank you so much, Ma. It's been very insightful. Thank you so much. Thank you. Thank you.
You're welcome.
Insight. Honestly, I didn't believe that maybe in this age and time, I know we all have our fears, but maybe just awareness would make us do those things we don't want to
Mm-hmm.
do, or we would not have wanted to do at any point in time. Like sometimes, truly, I get people when they say that when they say, oh, GP called them for something, they are afraid. Yes, we all have fears, whether we are doctors, we are teachers, we are human beings, or anything. So we all have our fears. So sometimes it's some of those fears that actually makes those diseases last long. And
Hmm.
like Dr. Kudirat said, once we are able to get it on time, the earlier the better. And like you said, is one of the highest cause of deaths in Nigeria among women or for cancer related death. I was really like, wow, this is very high. The bar that you showed us is very high. And truly, when I was in medical school, I usually see lots of people when they come in, we know that odor. We know that very strong odor. One can catch it anywhere. So I would just always say that, like Dr. Kudirat has said to us, we should make sure that we check ourselves, our hygiene. If there is anything coming out of our bodies we are not sure of, we need to we need to seek help on time. And that's the message. And to Sister Aminat and Sister Sister Abdat, thank you so much for all that you are doing. We are grateful. Thanks for enlightening us. Thanks for teaching us. Thanks for bringing us together. We are very grateful. And thanks to everyone who has joined in. Thank you so much.
Thank you
Thank
so
you,
So,
much, ma.
ma.
Thank you.
Thank you, ma.
Yeah. So thank you so much, ma. It's really insightful, and I'm sure a lot of people would have gained from this.
At the
All right.
slides.
Thank you, everyone. Have a great weekend and
Thank you
happy
so much, ma,
International
for
Women's Day.
joining.
Happy International Women's Day, everyone.
Happy Wednesday.
Yeah.